Hello, my name is Sarah Maines, the Liver Cancers Program Director at Global Liver Institute, the world's largest liver patient organization. At GLI, we bring together more than 200 organizations across our councils, campaigns, and events to advance liver health as public health priority. Our mission is to prevent liver disease, improve early detection, and scale the most effective strategies for supporting individuals and families impacted by liver disease and liver cancers. In this episode of our October is for Livers campaign series, we talk about metabolic dysfunction-associated steatotic liver disease, MASLD, a growing public health concern closely tied to obesity, diabetes, and metabolic syndrome. As MASLD progresses, it can advance to cirrhosis and later liver cancer, emphasizing the urgent need for early detection and tailored intervention strategies. I am delighted to welcome Dr. Jonathan Stine, a leading transplant hepatologist and recognized expert in MASLD and lifestyle interventions. Dr. Stine will share the latest insights into MASLD, including current screening approaches and evidence-based lifestyle and behavioral strategies to prevent disease progression. Dr. Stine, thank you so much for being here today. Now I'll turn it over to you.
Yeah, Sarah, thank you so much for having me. It's a just absolute delight to spend time with, the Global Liver Institute and the audience today. So thank you for everybody tuning in. And, we'll talk and spend the next 30 to 40 minutes together and, really, hone in on important, strategies for how we can help manage, what is, the most common, reason people have chronic liver disease worldwide, with healthy lifestyle interventions. So here are my disclosures, including some salary support from several industry partners and research grant support. But I'd like to start off our time today and just talk about one of my favorite patients, who we saw at the Penn State Health multidisciplinary MASLD program. This individual was a 62-year-old grandmother with diabetes. And I met her for the first time when she had newly diagnosed what we call at-risk MASH, or metabolic dysfunction-associated steatohepatitis. And, what this means is that, she had significant scar tissue in her liver over many years of having extra fat and inflammation. And when we first met, she, really wasn't sure what to expect. We talked a little bit about what she was currently doing. She was, decently active, but not quite meeting the guideline-based amounts of activity, doing about 60 minutes per week of activity, and consuming a diet, very similar to what, many folks, here in the United States consume. That's, high in processed foods, including fructose-rich beverages. And we got into things a little more. She said, hey, my primary care provider wants me to lose weight. They want me to start this medication called metformin. I don't really want to take any medication. And I've heard, diet and exercise are not good just for my health overall, but for my liver. So, I really want to make sure we prioritize this. And moreover, she also had a friend who had liver cancer. So we touched on quite a few things during this visit. For folks in the audience, this may describe things that you are struggling with if you're, an individual who's living, with this common, cause of chronic liver disease. And I think this, scenario brings up three things I'd like to discuss with you today. First and foremost, if you're an individual, who's living, with MASLD, I'd like to convince you to, buy into the disease and really take control of things. The second thing is we'll talk more about lifestyle intervention and exercise in particular. It's what I, love to do. Love to, be active ever since I was a young child. And I've kind of been able to turn that into, some professional passion. And I'll share the resources and research, with you, saying why you should get more physically active. And then lastly, if you're a healthcare provider who's tuning in, we'll talk about ways to prescribe exercise as medicine. Because at least here in the United States, U.S. medical schools spend 0 minutes teaching physicians how to prescribe exercise as a therapeutic modality. So let's get to our first question. Why should individuals living with MASLD care that they have this chronic liver disease? And before we go into this, you may have heard there was a recent, change in the terminology of the disease. Up until 2023, we used to call this non-alcoholic fatty liver disease as kind of the overarching umbrella term for this. We replaced that with MASLD to be a little less stigmatizing, to make sure we remove the word fatty, and also to make it, a more positive rather than a negative diagnosis. Right, non-alcoholic just has a connotation with it. And in a corresponding change, we saw NASH, which was non-alcoholic steatohepatitis, change to MASH. And you may say, well, that's great. John, this alphabet soup doesn't mean too much to me. But essentially, just think about, MASLD being extra fat in your liver. And then over time, this could progress to MASH, where you get inflammation and maybe develop some scar tissue or fibrosis. And if we don't correct this, you could progress to developing end-stage liver disease with cirrhosis, or even primary liver cancer called hepatocellular carcinoma. So what exactly is MASLD? Well, it's diagnosed when you have at least 5% of your liver that is full of fat. And this has to happen when you have at least one other metabolic risk factor. And that can be anything here shown in the table. So you can have a high body mass index, which is your ratio of weight to height. You can have issues processing, glucose or sugar in your body. You can have high blood pressure or high cholesterol with the parameters shown here. And don't worry, your physicians are going to be up on these things, and they'll be able to help you figure out if you meet these criteria. Now, if you're living with MASLD, there are quite a few, folks who are there with you. It affects, 25 to 30% of the world. Here closer to home in the United States, it's about 80 million American adults. And it costs the healthcare system over $100 billion each year. And as we touched on earlier, if we don't intervene with lifestyle, with medications, folks are at risk to progress to cirrhosis and liver cancer, and they may require liver transplantation. And in fact, MASLD is now a leading reason where we take out your diseased liver and put in a healthy new liver to get you some extra time with the folks that care about you. So why should we care, about this condition? Well, if you're living with MASLD, your chance of passing away is actually a lot more than folks who don't have it. So shown here is a nice research study out of Sweden with over 33 years of follow-up. And we can see in figure A that compared to the general population, individuals living with what was then called NAFLD, which we now call MASLD, again, remember that alphabet soup, have a greater chance of dying. And this risk of excess mortality increases with the severity of liver disease. So if initially you start out just with fat in the liver, your chance is lower. If you get to MASH with inflammation, your risk of dying is higher. If you develop fibrosis or scar tissue, it gets even higher, and all the way up to cirrhosis shown here with the pink line in figure B. Now, beyond this disease being very common and people passing away earlier, we should understand why the increased mortality happens. And it's not just limited to the liver. And in fact, cancer that develops outside the liver is one of the leading causes of death for folks living with MASLD, followed by cirrhosis, and then cardiovascular disease and primary liver cancer, which, as you remember, when I introduced the patient, at the start of the talk today, she was really concerned about this. I wanted to make sure she got adequate screening with ultrasound-based technology. But it's not just about the numbers, right? It's not about the number of people living with this. It's not about the tremendous, cost. It's not about the reasons, why we're going to spend less time here, together. It's really about how you feel, right? And if you talk to individuals living with MASLD, they feel worse than almost any other type of chronic liver disease. And shown here is data that's fairly old now, but it's withstood the test of time. There's been multiple studies that have shown this as well. But if you're living with MASLD, you actually have the worst health-related quality of life across all domains of health. So it's physical health, emotional health, social health, when you compare it to other, reasons people are living with liver problems, including chronic viral hepatitis. So this brings us to the point that we want to consider, effective therapeutic strategies if we're going to decrease the burden of this disease, help people decrease their chance of developing liver cancer, developing to transplantation, and help them feel better. So, luckily, we now actually have two conditionally approved medications, both resmetirom and then recently semaglutide, which many of you may have seen in the news, at least here in the United States, are approved under accelerated approval, and we look for more rollout here from a semaglutide standpoint. But even as we have two medications that are going to be helpful to put the brakes on this process and reverse disease progression to scar tissue and cirrhosis and cancer and transplantation, the cornerstone of this is still going to be focused on some of the choices we make every day, and we're going to want to make sure that we're making healthier dietary choices, and then trying to increase our physical activity. And I know you're going to tell me it's really hard to do these things. There are many different barriers, time constraints, pain, many things we'll touch on in the upcoming slides. But I'm here to challenge folks tuning in today to not forget about leading healthy lifestyle choices, and just to pick one or two things you can adjust. And we'll work on this together in our time together and then hopefully you can carry this forward after today's presentation. So this brings us to the second, question I want you to consider after the first patient, visit we talked about with that lovely grandmother, I've seen for several years now. And, if we're going to spend our time being active, we should understand why it's helpful, right? Everybody knows that it's good for us, but in terms of your liver, what are the benefits you can expect if you become more physically active? So shown here is a fun scientific slide. We're not going to dive into the details, but suffice it to say that the reason exercise is so wonderful is that it actually impacts multiple pathways in your body. And it can even affect a lot of the pathways that single medications are targeting. And it does this all at the same time. So, really this the panacea of treatment, response through various mechanisms can allow us to see many, different benefits in the liver and then beyond. And actually, if we look at a preventative standpoint, if you become more physically active and you just start walking 20 minutes every day, this will reduce your risk of developing MASLD by 20%. So for folks tuning in who don't have this condition, who maybe have a family history, who have other metabolic risk factors, but you haven't been diagnosed yet, get out there, start walking. Again, build up to this 20 minutes and you can reduce your risk of developing the leading cause of chronic liver disease, and then prevent yourself from developing complications 10, 20 plus years down the road. But when we look at not just a prevention standpoint, when we talk about, if you already are living with MASLD, what are the benefits if you get more active? They're tremendous. And we'll go through some of the science behind each of these things. But if you achieve guideline-based amounts of activity each week, which equates to about 150 minutes per week of walking, plus 2 sessions of resistance training. And don't worry, you don't have to go to a gym. We'll talk about strategies, things you can do just with your body weight. But if you do this, you'll become more physically fit. You'll reduce the fat in your liver. You'll gain more muscle mass. You'll decrease the activity from steatohepatitis, so lessen the inflammation. You'll lower your cardiovascular risk. You'll improve your metabolic disease. You'll feel better with better quality of life, and you'll reduce your body fat. And if I was going to put this any other way, I just would say, hey, all those reasons I said why you should care that you're living with MASLD, exercise can help with each and every one of them. And let's talk about the science behind, why this is possible. So I'm going to show some data from some of the clinical trials that my research group at Penn State has conducted. And we've spent the last, 8+ years looking into how we can help folks here living in central Pennsylvania become more physically active, and then therefore, help lessen the burden from having fat and inflammation in their liver. And this is perhaps my most favorite slide. And I'm just going to sum up some of the data, but this was a 20-week study, and folks who did that guideline-based amount of activity, so 150 minutes per week of moderate intensity activity, such as walking. And actually, we didn't do any resistance training in this study, but if you just walked at that amount, 1 out of 2 individuals actually achieved significant improvement in their fitness. And this is defined as an improvement of 10% of fitness. And we set this as the benchmark because if you improve your fitness by 10%, your chance of dying in the next 10 years goes down by 15%. And that's pretty powerful medication, or pretty powerful evidence. I don't know many medications that can ascribe to that, beyond if we use exercise as medicine. So again, get more active, you get more fit, you'll reduce your mortality if you're already living with MASLD. And if we talk about liver-specific benefits, beyond just knowing that your mortality is less, achieving guideline-based amounts of activity will reduce your liver fat significantly. And actually, if you get to that amount of exercise each week, you'll have clinically meaningful reduction of your liver fat, which we term as at least a 30% relative reduction. And this happens 3.5 times more often. So your mortality goes down through gains in fitness, your liver fat is less. And then we'll take away the inflammation in the liver as well. And shown here are multiple different biomarkers of inflammation and MASH activity. In figure A, it's a liver enzyme. In figure B, it's something called cytokeratin 18. And if we put biomarkers together, so things that tell us how active the disease is, in figure C, we can combine MRI biomarkers and blood-based biomarkers. And we see that your chance of your MASH going away is 3 times more likely if you achieve guideline-based amounts of activity. So mortality goes down through gains in fitness, less fat in the liver, less inflammation, and MASH can actually go away. And what about the scar tissue, right? So we're not entirely sure how long it takes scar tissue or fibrosis to reverse at least one stage in the liver with exercise in the absence of significant body weight loss. So Put another way, we still think you have to lose, probably 5 to 7% of your body weight, if not more, to reverse fibrosis when we look just at exercise as a standalone therapy. But our research group is trying to answer this question, if you don't lose the weight, can we still improve the scarring? And the answer is probably yes. We have some, fancy basic science markers here where you look at the cells in the liver called stellate cells, and they become less active with exercise training. And then they produce less of the things that lead to that fibrosis or scarring. So we'll kind of see how the story goes. Our trial is ongoing to answer this question, but we're hopeful to have some answers here over the next year or two. And I'd be happy to share that with the GLI audience if invited back. So shown here is a summative, slide of the exercise, benefits you can expect with your liver. Again, liver fat gets better, MASH gets less active and even goes away. And then hopefully over time, if we sustain this amount of activity, we'll see the scar tissue, stop building up and perhaps even get better. And that's really what we're trying to do with any therapy, because we think fibrosis or scar tissue is what drives bad outcomes. And it leads to then increased, mortality that we talked about through preventing, progression, to transplantation, with cirrhosis and primary liver cancer. All right, but enough about the liver. I promise you there are other wonderful benefits to exercise. Shown here are some of the changes you can expect where you'll reduce your adipose tissue around your organs called visceral adipose tissue in the graph on the left. And this happens through changes, in body composition and ultimately, the signaling that happens between the muscle and the fat cells in the liver to go ahead and reduce, the amount of fat in your body and increase your muscle mass. And we think that these changes in body composition actually mediates a lower risk of cancer. And, it's really hard to prove that exercise reduces cancer risk. You'd have to do a very large study with a clinical trial. So we have to rely on what's called epidemiological data, where we look at large, data sets of patients. And shown here is just data from the general population. And we can see that if you're physically active, your chance of developing liver cancer is lower. And we do think that body composition is ultimately responsible for some of this. So when you lose fat, you gain muscle mass. We think this drives some of the lower cancer risk if you're more active. All right, other things exercise does, it'll reduce your cardiovascular risk. Shown here are biomarkers of risk. So again, we can draw things from your blood and predict future, heart attack, stroke, heart failure. We can see that these markers go down if you're more physically active. And then again, I promise you'll feel better if you get active. It's not a lot of fun in the beginning, right? We have to build a routine. But shown here is data after 20 weeks that each one of those domains of health that we talked about in the beginning, where you don't feel well, mentally, you don't feel well physically, you don't feel well socially, they all get better with exercise training, and you'll sleep better. You'll have less pain, you'll have less fatigue, your mood will be better. You'll feel more supported from a social standpoint. So again, many wonderful things that becoming more physically active will do if you're living with MASLD or MASH. So I hope I've convinced you that you should care you have this condition for many different reasons, that exercise may be able to address each and every one of these, and even simultaneously where medications target specific, pathways and may not address each and every one of those, reasons why I implore you to care about your liver. But, again, if we're going to be successful, we have to know, how we are to become more active. And some of this goes back to educating clinicians. So for the healthcare providers, on the line today, we'll talk a little bit about strategies and ways that you can encourage your patients to become more physically active. For the patients tuning in, I think it's helpful, to hear some of these things, because you can go to your doctor and say, hey, have you considered using some of these tools? I'd like to become more physically active. And I would hope they would have conversations and support you. And I'm sure that, your healthcare providers are willing to do this. So whenever we think about behavioral change and helping people make lasting change in their life, we need to have a systematic process, right? We are all creatures of habit. There's hedonic adaptation. So, you buy a new car, right? It smells great. You drive it. And after 3 months, you kind of forget that you have it. And the same thing happens with lifestyle intervention, where we get really fired up to become more active, to eat healthier, but then we kind of go back to our old habits. So, in recognition of this, if healthcare providers have a framework to establish, what their patient is doing through a screening process, and then convincing them that, intervening is helpful. So again, it goes back to what we talked about with why, we should care that, people have MASLD and why exercise is good. And then ultimately setting up a referral for treatment where either you can prescribe exercise, we'll show a prescription pad here in a couple slides, or yes, I still physically write the exercise prescription and give them the patients, or you can even refer out and get your favorite exercise professional to help your patients. So in terms of screening, right, we need to make sure we're getting accurate information. And the question is, who should we screen and when should we do it? And luckily, the American College of Sports Medicine makes it easy for healthcare providers. And they say that all patients living with MASLD should be screened for physical activity. And this should be done at every healthcare interaction, from the primary, care visit where you go in for your annual, to your specialist care where you're referred. And you may say, wow, that seems like a lot of work. How are we going to do this? Well, we need to have a tool that is easy to access and is cheap and is something that can be done, very quickly. So the American College of Sports Medicine came up with something called the Physical Activity Vital Sign. Bob Salas, came up with this, in the mid 2000s, and it's wonderful. It actually integrates into electronic health records. I provided a QR code here for folks, on the webinar today. If you want to scan this and download the questionnaire, and I encourage you to incorporate this in your practice. But just by answering 2 questions, you can find out what your patients are currently doing and if they're meeting that guideline-based amount of activity, which we've talked about. And spoiler alert, most people are not, who are living with MASLD. In fact, only 20% are meeting guideline-based amounts of activity. So again, having this questionnaire to get an accurate snapshot is really important. And then from there, if your patients are not as active as you want, we don't blame people, right? We ask why. What prevents people from being more active? And our research group, published and developed a questionnaire. We validated internally within our program here, and it is specific to folks living with MASLD. And we found out that if you have this condition, you're not really that much different than other folks who are less active. But the number one reason why people are unable to get to that guideline-based amount of activity is they say that they don't know how to exercise. The second thing is they don't have time. People also with MASLD report exercise as painful. And then cost is on everybody's mind, especially, with the current, political climate and the economy. So we need to keep all of these things in mind when we are going to, go ahead and complete this process and work on getting people more active. So when you screen somebody, right, the first question is, how much activity are you doing? If you're not meeting guideline-based amounts of activity, the second question is, why not? What prevents you? The last question is, what are you capable of? And, again, we're not going to, push somebody into getting to guideline-based amounts of activity immediately. You have to build things up, and you have to have a target, and you have to have a plan. And, in order to figure out what somebody can do, you have to have, an approximation of their fitness level. And, we're not going to send everybody to the Penn State Health, Exercise Research Center, put them on a treadmill, wear a mask, measure their maximal fitness. Instead, we have to have something to do in the clinic. So luckily, there's another questionnaire here. It's called the Duke Activity Status Index. Again, the QR code is provided for providers on the call. And this series of 12 questions can approximate the physical fitness. And if your score is below 32, we know that your patient has poor aerobic capacity. And this is somebody who you're probably going to want to have a more ramp up period, a longer time before you get to that goal of activity, and just something you have to keep in mind if you want your patients to be successful. All right, so that's screening. Again, what is your patient doing? What prevents them from getting to the amounts you want them to be at in terms of exercise? And then lastly, what are they capable of, when you think about how to intervene and set up your exercise program? The second part is where you get to shine as a healthcare provider. This is your time in the sun where you really onboard people. You convince them why getting active is great. And again, ACSM tells us that at every visit, we shouldn't be not only screening, but we should be talking about physical activity. And how are we doing in the real world? The answer is quite poor. And only 3 out of 4 healthcare providers spend any time talking to individuals who are living with MASLD about leading a healthy lifestyle. And we're even worse when it comes to referring for dietary counseling. Only 1 out of 2 patients are referred to a dietitian. And then we look at engaging our exercise friends and our exercise colleagues. Only 1 out of 10 individuals with MASLD are referred to an exercise professional. So clearly there's more work to do, and part of that is today's webinar and for making sure that we have tools that are easy for people to use. So again, I talked a little bit about the exercise prescription pad. Shown here is a screenshot from a paper Zach Henry, University of Virginia, and I published a little while ago. But we actually have this physically in the clinic. And in a day and an age when everything is digital and you call in prescriptions and refills, when somebody who sees you and you meet with them one-on-one and spend time with them, and they leave your clinic and they have a physical piece of paper, that makes an impact. And what you can do is you can literally just go down and circle each one of the things on here, and we'll talk about these elements of an exercise program in a slide or two. But in 15 seconds or less, you can actually figure out what you want your patient to do, and then hand them the prescription. And this is going to make a lasting impact. I have patients, put this on their refrigerators. I have patients who bring things back to me in the office to show progress. So, this is an absolutely wonderful tool. It's free. It's in the paper shown here. And again, if we're going to use a tool, we have to understand, how exactly we do this. So the things on the pad are frequency or how often somebody should exercise. Intensity was self-explanatory, right? It's how hard. And then time of exercise for each session, and then the type. And we'll kind of go through each one of these things. And, luckily, ACSM, the American College of Sports Medicine, has a nice summary for us in their exercise testing book. It's available online. But when we talk about the two different types of exercise, there's both aerobic exercise and resistance training as kind of the two mainstays. And let's talk about the aerobic side first. So, if we're going to get to amounts of exercise that help your liver and create those wonderful benefits, outside the liver we talked about, you have to do it about 3 to 5 days a week. And in terms of the intensity, it should be moderate or vigorous. And you may say, well, what does that mean? I don't want to wear a heart rate monitor. Well, we talk about the talk sing test. So, if you're there and somebody is next to you, on the treadmill, or you're out for a walk, you should be able to talk to them and not be able to sing. If you can sing to them, you're going too hard. You need to back the intensity down just a little bit in order to get the greatest metabolic benefit and remove fat and inflammation and possibly scar tissue from your liver. Okay. In terms of time, we recommend at a total of 150 minutes per week of that moderate intensity where you can talk to the person next to you. If you're more conditioned, you can always do vigorous intensity activity, where you can shorten the amount of time spent per week to 75 minutes. And again, aerobic activities, everybody knows these are pretty self-explanatory, but it's prolonged rhythmic activity, where we use our large muscle groups such as walking or cycling or swimming. Now, the other side of the coin is resistance training, and I'd say folks are a little less familiar with this, and we want people to do this on 2 non-consecutive days each week. Again, the intensity is going to be moderate, depending on what your goal is, and if you want to get stronger, you're going to do fewer repetitions, shown here. Then if you want to have more endurance in your muscles, we do 12 to 20 repetitions for each exercise. And you may say, well, John, I'm never going to remember this. And luckily we'll have a slide here showing a typical exercise training program you can do without any sort of equipment. But before we do that, let's talk about the evidence. Why do we say moderate intensity? Well, it turns out if you're doing anything less than that, it's just not effective. So you have to be doing at least that moderate intensity activity to get fat out of your liver. And why aerobic versus resistance training? Well, shown here is an indirect comparison of the different modalities. The best way to exercise is going to be the upper right part of the graph here. We can see that resistance training plus aerobic training wins each and every time when we look at the parameters we want to improve. Okay, we'll talk more about resistance training because, again, folks are a little less familiar with this. To reiterate some of the previous points, it's 2 non-consecutive days you want to do this, whether it's Monday, Thursday, or Wednesday, Friday. And you can go to the gym, you can use resistance machines, you can use free weights. I have patients who just use exercise bands or even do body weight activities. So again, you don't have to go out and spend a lot of money. You don't have to travel in order to be able to do this. And in general, when you target each one of the muscle groups, about 2 to 4 sets of 8 to 12 repetitions should be enough to get that physiologic stress that you want to do to be able to get to a lot of those benefits we talked about. Shown here is one of our clinical trial participants who is doing a fairly standard resistance training program. Note that he's using a combination of body weight and resistance bands. And we target each one of the 7 major muscle groups. So the first example, he's doing push-ups, but they're done on a wall. just to help, make sure we can, get the correct, range of motion, given some physical limitations when you're living with MASLD. The second exercise are wall angels. You can see the movement with the arms to go ahead and target the back. The shoulder press is done with a resistance band, and then bicep curls. I think everybody knows those, but you can stand on the band and just do the curls, and you can get progressive bands to make things harder. You can also do, a squat on the wall where you lower yourself up and down to target your legs, and then you don't have to jump on anything. You just do step up, on a bench or a box if you're at a park. That'll target your glutes. And then seated calf raises are also good. And then core is kind of the eighth muscle group, where you don't have to do crunches, you don't have to do sit-ups and things that you hate from gym class when you're a kid. Just simple exercises, where you're doing what's called a bird dog, where you push your arm out and your leg back simultaneously, as shown here in this picture, are really going to target each and every one of these major muscle groups. Other options that folks can consider, if you don't, want to do aerobic and resistance training separate, you can kind of combine them together and do a high intensity interval training. And you may say, well, that sounds like it's going to be a problem. High intensity might be hard to do. But we've shown that if you do this in a structured setting where you have an exercise professional supervising your patients, they can not only complete it without injury, but also get similar benefits to what you see with some of those traditional programs where you combine aerobic activities such as walking with some of those body weight exercises 2 days a week. And shown here are just examples of different things that folks can do. And these are all low impact. So meaning there's, very little stress on the joints, which will lessen, the risk of any injury with, this high intensity type program. All right. And this is a lovely summative slide. We've talked a lot, about different types of exercise, different intensities. It's a lot, of numbers. And we're kind of got in the weeds a little bit, but you may ask, what are we trying to do? Why do we pick what we pick? And the reason is, we're trying to deliver a physiologic stress on the body or a dose of exercise. And you may say, dose of exercise, what does that mean, John? I know about dose of medications, and we'll take, metformin as an example. So if you want to prescribe this, like in our grandmother, we opened today's webinar with, you take metformin at a dose of 500 milligrams of drug strength. Have them take it twice a day, every day, and then you're going to perform some, reassessment. So bringing, our grandmother back, in 3 months' time, to go ahead and, see how our blood sugar is doing, the hemoglobin A1C. So if we take this, common scenario in this analogy and apply it to exercise, we're going to look at intensity. So how hard your patient is going as kind of that strength. Frequency of exercise, how often they're going to administer, the exercise. And then time is self-explanatory. So, here we can see that if we want to get to that magic guideline-based amount of activity, all you have to do is a brisk walk 5 days a week for 30 minutes. And you may say, okay, well, how do we know that's the amount? Well, shown here at least is, a breakdown where we look at folks who get to that amount versus those who don't. If you get to that amount in the dark blue, bar graph here, we see that there's, you're 60% more likely to get to that threshold of reduction of fat in the liver, which tells us that if you sustain this, that, the liver should be less inflamed, the mass should go away, the scar tissue should go away over time. All right. And if you're a healthcare provider, you may say, okay, I'm never going to remember everything you told me in this very short webinar. Don't worry, you don't have to. The American College of Sports Medicine has a fabulous, handout that you can refer back to. You can actually, again, physically give this to your patients when you see them in the clinic. There's a QR code, again, if you want to download this. And it summarizes, the recommendations I made for aerobic and resistance training. And also, don't forget, you can phone a friend, right? So if you don't want to do all this in the clinic, you don't have the time, you have to talk to folks about 6 or 7 other problems, you can always engage, a friend. And, an ACSM wants us to think about engaging an exercise specialist, for all patients living with MASLD. And you may say, well, why would I do that? What exactly are they going to do? Well, they're going to augment a lot of the things you do in clinic. And an exercise specialist can help you with cardiometabolic risk factor assessment. They can help you with formal physical capacity measurement. Remember, we talked about, using a questionnaire, the Duke Activity Status Index, to approximate fitness, where they can actually formally assess it and get a more reliable measure. They may spend more time with your patient and be able to identify things that they're struggling with, which could impact, their liver. Maybe they're living with sleep apnea, and you didn't have a chance to measure the neck circumference, of your patient in clinic. So it is, valid to have, more folks helping here. And lastly, they can, refer to other allied health professionals such as dietitians. Again, remember in the slide we showed only 1 out of 2 individuals living with MASLD actually are referred for formal dietary counseling. So this can be some inroads here to really make an impact for all of your patients. I hear from people, a lot that they say, well, I don't have, a friend or a colleague who's an exercise specialist. And luckily ACSM has an answer to that as well. It's called ProFinder. And from here, you can put in your geographic location and pull up whatever level of certification you want to ensure your patient is going to be properly supervised. And from there, the database, spits out a large, list of folks you can refer to. If, you're a patient, an individual living, with MASLD, and you just want to take the initiative by yourself, please, access, this resource here with the QR code, find a trainer, find somebody you can work with, to go ahead and augment all the wonderful things you're already doing with your healthcare providers. All right, so we've spent a long time today together. We've talked about how MASLD, is common, that it costs a lot, that, people living with this, die prematurely from many different things. And we've also discussed that if you're living with this condition, you don't feel well. But all hope is not lost, right? We now have 2 treatments that, from a medication standpoint, are approved by the U.S. Food and Drug Administration. And I would encourage folks, to talk with their healthcare providers about this to see if you qualify. But even if you don't, or even if you do, becoming more physically active and eating healthy will ultimately, impact your trajectory here. And if you're able to get to that guideline-based amount of activity, the benefits are immense. And we've gone through each and every one of the benefits, the supporting evidence. And then we've also provided some recommendations and tools here for your healthcare provider to go ahead and take the next step, to set up the resources for you so you can be successful. And speaking of success, I'd like to take you back to, our lovely grandmother, again, who I've known for many years in my clinic, and just kind of bring you up to speed to let you know what happened with her, right? We don't want to leave you hanging here. So remember, she was worried about liver cancer. She had a friend who passed away from this, given that she had advanced scarring of the liver, plus another risk factor with diabetes. We did elect to screen her for liver cancer with an ultrasound. Luckily, it came back. It didn't show anything concerning. And then we were able to structure an exercise training program for her. And, initially, like many folks, she struggled with consistency, but with several check-ins, just by phone or through the patient, portal with electronic messaging, we were able to onboard her and get her to that guideline-based amount of activity where she was completing 150 minutes per week of walking, plus 2 days of resistance training. And when I saw her back in 6 months, she was a little frustrated. She only lost about 3% of her body weight. But when we repeated her fiber scan, which is an ultrasound that shakes the liver and measures the scar tissue, we can see here that she went from stage 3 scarring back to stage 0 or stage 1. So that's a tremendous improvement in 6 months. I was really proud of her. Moreover, she didn't have to go on metformin. She reversed her diabetes with her A1C below the cutoff where medications be indicated. Her cholesterol was a goal. And then given the fact that, her diabetes went away, her fiber scan was better, she no longer required screening for liver cancer, which she was just absolutely delighted about. But the greatest part of this visit is she said, hey, Dr. Stine, can we please, hurry this up? Because I can't wait to go home and exercise. The visit today, is preventing me with my usual 9:30 training session. And I don't want to, not complete this. So we hurried up the visit. We got her out of the office. And, she's still maintaining this activity several years later. Her disease remains as well controlled as it is. And at this point in time, I don't expect her to ever progress to, developing a liver cancer, to needing that life-saving liver transplant. And it's all because she became more physically active and used some of the tools we discussed during today's webinar. So I hope you found this helpful. I hope you enjoyed our time together today. I know that I have. Thank you so much for stopping by.
Dr. Stine, thank you so much. I love the story about the grandmother. I feel like we're all super motivated out of everything that you've shared with us today. And I really appreciate you providing such valuable insights on MASLD. I feel like your expertise will definitely help us understand the realistic changes that we can make to our lifestyle. So thank you, because they're practical. We can do this. They are helpful. This is how we can advocate for our own health and our loved ones, and certainly the patients that we serve and supporting their outcomes. So we truly appreciate and value your time today.
Yep. Yeah, you're welcome. It was a delight again to stop by and share many of the things our group's worked on. It's been a work of passion for the last 8+ years, and I'd like to think we've helped a lot of folks here in Central PA, and now it's about getting the message out more broadly here, not in the States but even just internationally. So thank you for your interest, and for everybody else for stopping by today.
Absolutely. And we will certainly amplify your voice and message during October is for Livers and moving forward. And thank you to everyone who has joined us today. We welcome you to find more information out about Global Liver Institute and the work we do. And please visit us at globalliver.org or explore livercentral.org, our hub for liver disease and liver cancer research and resources. Once again, Dr. Stine, thank you. And thank you to our sponsors for today.